Good morning, everyone. I'm Mary Funseth from Medistar, partner with Superior Health Quality Alliance. And we want to welcome all of you to the first session for you to be oriented to affinity groups. Today, we will be gathering for 30 minutes. We want to make sure you know that we are recording the session. And that means that it will be available to you to come back to if you'd like and or share with others of your team.
Thank you, Mary. And so as you see on the slide here, CMS has 5 bold goals that are part of this work that we'll be doing over the next 4 years now through the end of 2024. So these, as I said, these may look familiar to you if you were on our call in November, our kickoff call for this work in November. At that time, we didn't go into a lot of detail, so I just kind of want to provide a little more information on each of the goals. If you want to go to the next slide, Tony. The first goal, and I should just say too, these goals aren't in any order of importance. This is, just the way they got numbered. So not one goal isn't any more important than the other goal. So the first goal is improving behavioral health outcomes and decreasing opioid misuse. As many of you probably know, substance use disorder, and this includes opioid misuse and behavioral health conditions. In our Medicare population, these diagnoses go quite frequently under-identified in our primary care settings. So we are hoping to bring these more to the forefront for that Medicare population. This can cause challenges when they're not identified in this population, and also can contribute to high readmission rates and problems with treatment adherence. As part of this week, we really want to work with our providers and helping them decrease opioid-related overdose events and increasing opioid safety, of course, but also spreading those opioid prescribing best practices amongst our providers. And as Mary mentioned at the start, if you want to start using chat, putting in those things that maybe you're already doing within your organization or your facility that are part of this work already, maybe you have a program that you're working with on your prescribers for using those best practices, or maybe also WIT as a goal. Maybe you don't have anything in place at this time, but you'd like to start working on it. So we're just, want to see how this work is aligning with what you're currently doing. For the second goal, we're talking about increasing patient safety. Adverse drug events, or ADEs, contribute significantly to patient harm and also can trigger unnecessary diagnostic tests and avoidable hospital admissions and readmissions. You're probably starting to see a theme here. Quinn QIOs have worked within this scope for the last couple of years, but are actually uniquely positioned to do this type of work and helping, especially we've worked a lot with nursing homes and hospitals and improving medication safety. But a lot of this also comes down to communication and coordination amongst the different entities within a facility, but also amongst the different organizations altogether in the different facilities. So those handoffs, making sure that the information is shared. Along with working on reducing adverse drug events, we also want to reduce C. difficile in all settings of care. And so for all of this work in our community coalitions, we're working with all types of organizations. So we're working with hospitals, nursing homes, home health, clinics, and for the C. diff, along with wanting to reduce C. diff, we're also looking especially to nursing homes, reducing those hospitalizations from C. diff that originate with a nursing home onset. The next goal is increasing chronic disease self-management. Superior Health and its organizations, Stratus Health, MPRO, and Medistar, have all been part of the Million Hearts work since its inception in 2011. And as you, again, probably know, CDC, according to CDC, heart disease, and this includes hypertension and stroke, are the first and fourth leading causes of death in the United States. So we're looking at how we can help to reduce these events within not only Minnesota and Wisconsin and Michigan, across the United States by working on this self-management of heart disease. So how can we help patients manage their hypertension or manage their high cholesterol and make sure they're taking aspirin appropriately? And then smoking cessation is another big part of this. Also in the United States, looking at the second bullet point there, almost or over 1/4 of the citizens of the United States over the age of 65 have diabetes or have been diagnosed with diabetes. And kidney disease diabetes and hypertension are the 1 and 2 causes for chronic kidney disease. So as you can see, the first and second bullet points really lead into our third of helping to reduce the progression of chronic kidney disease. So for those with diabetes, again, we're looking at how we can help them with the self-management. For those who have already been diagnosed, how can they better manage their diabetes? And then also for those who have been diagnosed with pre-diabetes, how can we prevent them from moving into diabetes? Are there education that we can do to support that so that they don't progress to having diabetes? And then for chronic kidney disease, what we want to look at by helping our patients control their hypertension and diabetes is one way, but also how can we identify those patients, especially in their primary care setting, that are in stages 1 and 2, making sure that they're having the appropriate tests so that they don't progress to stages 3, 4, and 5, where they would need that dialysis. So that's part of our preventing or reducing chronic kidney disease. For the fourth goal, we are looking at how can we increase the quality of care transitions. As I mentioned in the second goal with patient safety, a lot of this, is making sure that we're having those, warm handoffs and information is getting shared among facilities. And so for the quality of care transitions, we want to make sure that we're improving those transitions of care so that we can reduce the unnecessary hospital readmissions or admissions altogether. There's studies out there that have showed that if we can reduce those avoidable admissions and readmissions, and a lot of this again is that communication, making sure that all the information is shared and that everyone knows what everybody else is doing within the healthcare systems and healthcare facilities, we can reduce healthcare costs by $1 billion over a 3-year period. Past studies have shown that. Another big contributor to this is, of course, reducing those community-based adverse drug events. So just as we mentioned in goal 3, how can we make sure that medication management is happening? So not separate in the hospital, separate from the clinic or separate from home health, but that everybody is working together and that we're not siloing this information and everyone knows what everyone else is doing. We're also looking at how we can reduce the rate of emergency department visits by our super utilizers. As many of you know, there are some patients out there who use their emergency department as their primary care facilities or their primary care provider. So how can we identify these super users and get them hooked up so that they are working with a primary care provider, like in a clinic setting? And again, too, I just want to remind everybody for each of these goals, if there's specific things you're working on or want to work on in the future for them, please just go ahead and add those to chat. And then the last goal is improving nursing home quality. And we want to work with our nursing homes to help them improve their nursing home compare quality scores. And this will help also improve our resident satisfaction and help them impact the quality of care that is being provided. Along with this, we're also looking at how we can avoid those emergency department visits and readmissions that maybe aren't necessary. Is there a way that we can provide that care in the nursing home instead of transferring them to a hospital? Also, looking at preventing those healthcare acquired infections. C. diff was one that we mentioned previously. Also, we want to improve immunization rates. Not only the flu immunization, but of course now we all are quite aware of the COVID-19 vaccination that is becoming available. And then how can we work with our nursing homes in their response to COVID-19? What support can we get them? How can we help them identify infection control practices that they can put in place? And that is all I have. I'm going to turn it over to Janelle.
Okay, so what I'd like to just share a little bit about is how you can participate with us on this initiative. And so we've designed this approach to be flexible and meet you where you're at. And it's essentially all virtual. So on this slide is just kind of the big picture of it, but it shows in the kind of the gold color, the 5 goals. You can work on any of those 5 goals using any of these 3 approaches. You can work on multiple goals at one time, you know, especially if you're a bigger organization, and you can work on multiple strategies of these 3. So it starts on the left with least intensive to middle intensive. The affinity and structured would be the most intensive. So Tony, if you would advance the slide, then I'll go into detail about each one of these. So the first one is independent approach. This is basically if you are working on one of these topics, you're doing pretty good, you have a lot of resources, but you know, you'd like to tap into or see what other things are out there. So that's why we called it independent. So it's really autonomous. So things that you would have access to from Superior Health would be information and resources such as action guides. So there will be one of those for each of the topics, different assessments that we have. You'll be able to receive data reports, particularly if you're an organization like a clinic or a hospital where you have data related to these different goals. We will be sending newsletters, e-blasts, you'll get that. It's all virtual. And then we list specifically out these action guides, which are web-based tools. And looking down below for some things that are coming, and I'm going to stick something in the chat about the Frontline Forces here, which is a nursing assistant education and collaboration series. So Tony's been on this team to develop these. So Tony, if you would please just describe what Frontline Forces is in, and meanwhile, I'll put access to it in the chat.
Awesome. Thank you so much. Yes, as we were getting together and thinking about how we could impact the goals and the care quality and safety of the residents and the individuals that we're talking about, we really felt that there was an opportunity to get the frontline staff really involved, which hasn't historically been done in other work that we've done. So we created Frontline Forces, a nursing assistant education and collaboration series to really empower the nursing assistants by providing education and knowledge that helps them better understand some of the principles of care and why they're so important. So we've developed a 3-part introductory series that addresses pressure injuries and the role of the nursing assistant in prevention of pressure injuries. And we're currently working on an infection prevention series, hand washing, PPE, and environmental cleaning. And I know Janella is going to put that link in for the Frontline Forces. Just a note, we met yesterday and we have some editing that we want to do as we're learning more about what we think people are needing and wanting in terms of education. We currently or continually are trying to update the program and the processes. So if you happen to go in now, for example, today, you might find that there's a note that says it's under maintenance, but it should be available again on Monday as we get through making those changes. So if you have any specific questions about that, about Frontline Forces, our contact information is at the end of the presentation, and you can feel free to reach out to me. So thank you.
Yeah, thank you, Tony. And I put it in the chat along with, you need like a little passcode because it's just for those that are participating in the initiative with us. But you have the code now, so anybody can go in and look at stuff, and they will be building on this series too. Then there are a couple other action guides that will be coming up soon. One is on patient and family engagement, and then foundational components to support a safety culture. Thank you. The next slide talks about the middle area, the affinity group. So this is kind of moderate level of intensity, and that's what we're doing today. So the thing I love about this is it's a more casual atmosphere where you're basically getting together virtually with people who have interest in same topics, or you might be from a a similar setting. So there is just really no limit to the different types of affinity groups that we could have and host. We will start out with some from our ideas, but then we would love to have your input on what you would like for an affinity group. So affinity group is a group of people who meet typically monthly using this platform, Zoom, and we have a couple of different approaches planned. So one would be a monthly, we call it a best practice sharing call. So say it's on a particular topic, I'm just gonna use readmissions. And somebody in the affinity group has done something cool about readmissions from, say, hospital to nursing home. So they just share and tell about what they're doing. Other strategies that we'll use is something even less informal called coffee talks. So this would be where we're thinking like maybe in between those best practice, we would host a coffee talk, which means we put a topic up and we just kind of chat about it, for a half hour or so. Other ideas are breakout rooms. There's just really no end to it. So the upcoming opportunity will be, we're starting out with some like quality improvement basics. And so we'll be hosting a group called the Foundational Components, which support a safety culture in early 2021. And you can see that is something you can do as independent approach, an affinity group, which is really just more networking and sharing and learning from each other, or more formal, a structured collaborative, which is actually going on right now. Next slide, please. And then the third area is called the structured collaborative. So this is, I'd say, the most intense, but it's for a group of people or organizations that want to work more intensively on implementing a best practice, or maybe you're new to quality improvement. So for example, right now, a group started last week on this foundation of components, which supports quality safety. So it's for people that are new in quality improvement, or maybe you're just getting your team together, but they'll be covering some of the basic things. And so I'm actually sitting in on that as well. And there's a smaller group, so about 20 to 25 to 30 folks are on that, and they meet weekly. So the structured collaboratives meet more frequently. They're going for like 6 weeks. These first two are going for 6 weeks. The one that's coming up that you can still sign up for is called Leadership and Organizing in Action. This is a 6-week program. Let me see where my notes are. It starts January 19th through February 22nd. And it's created for those that want to learn on different leadership models and strategies. You can use the training here for really anytime you work together, but specifically thinking if you are a part of a coalition and how to build a coalition. I've been through the training myself, and actually I'm going to be working on this team, but it's fantastic stuff. So even if you know quality improvement well, there will be some great tips on this. And I'll be, when I'm done talking, I'll be putting in the chat how you can register for that. Okay, and then just want to let you know that we have been supporting healthcare organizations since this pandemic started. One gap that seemed to be in the healthcare setting was that there wasn't much opportunity for across settings to network and share. And so we've been hosting what we call an all setting open forum virtual meetings. And we started out doing them every week when the pandemic first started, the end of, well, it started before this, but like at the end of April, early May, and then gradually dropped it down to every week. Now we're going once a month. So our next session will be January 28th. It's on a Thursday. If you're in Central Time Zone, it's 9 to 9:30 Central Time Zone, or 10 to 10:30 in Eastern Time Zone. And so you'll be hearing about that topic pretty soon. Also, I wanted to mention that we know that COVID is like top on your list, high priority. And even though you may be working on these, you saw these 5 goals, COVID fits into every one of those. And so we call them subject matter experts for each of these topics. And they have offered up a couple of COVID related topics. So when we first start out, we'll be focusing on embedding COVID in all of these areas. So I'm going to just stop a little bit and ask my team if there's anything else that you guys want to share about the implementation or something that I forgot.
I would just like
You
to
covered
mention
everything.
if they haven't visited the website, there are a lot of resources, that you might find helpful, and we're adding them, as we go. So continue to check frequently.
Great. And I just put the link into that leadership and organizing in action in the chat. So it's not unlimited space. So if you're interested, I would say go ahead and sign up as soon as you can, because they are going to cap the numbers. And I think it goes now to Mary.
Mm-hmm.
Yeah.
So to sum this up, we are, as one of you have mentioned, I think it might have been Deb, that, there's a lot of stuff coming to you right now. And you're going to see it in forms of e-newsletters, e-blasts, which will be the e-newsletter being one that doesn't come quite as often and is sort of a collection of things, places to get to understand sort of what's coming up in the future, as well as some resources within those. The e-blasts are a little bit more about sort of real time need for you to pay attention to possibly signing up for something, and any other quick changes. We are going to be having a learning management system. What that is think about things like LinkedIn, Facebook, any other sort of area where you can go to find things about your group. We're going to be setting that up fairly soon. But for now, and that's where, we are going to be having these guides sit. There will be announcements and other ways to just network there beyond going somewhere. Great opportunity for those who are going to be really only utilizing the independent approach. Sort of a one-stop shop, place to go get everything. And then as Tony mentioned, right now we have everything out there on the website, and that's growing every day. And eventually, most of the materials will end up there on that learning management system. That system is going to have a name, but for now, we just have to call it the learning management system. And again, we will keep you updated. Next slide, please. So we really want to make sure that you know us. Myself, Janelle, and Tony are the current team that's working on the affinity groups. And so we really need to know, what's most important to you. I put it in the chat that you can chat in any sort of priorities that you may have right now that you're hoping that an affinity group would form. Know that affinity groups, as we mentioned, can be formed in, around a particular clinical background or profession, or it could be something that, in an area, and you want to think about that area with your colleagues in the community, bringing together a nursing home, a hospital, a food bank, a church, bringing together the clinics and the walk-in surgical centers and so on. I mean, it's endless. So please let us know. Thank you, Stephanie, for stating that you're finding ways to hopefully make this clear. But if it's not clear, let us know, because that's what we are here for. We are considered quality advisors. I also like to think of us as, we are navigators. We're here helping you navigate through this. There's going to be a lot of information. And as you're so busy doing that frontline work and taking care of all the staff that's doing the work as well, we can be here to help collect some of those things that you need. So in this forum, to have an affinity group, you can come here as we did today. And it won't necessarily be, as Janelle outlined, it won't necessarily be a presentation. It may be a day that we come together and you pop in for a few minutes, see who's here, and around an area that you're working on. So definitely reach out to us if you'd like to get something started, because we can do that. So I think what we'll do is we will end the call now, and we look forward to seeing you all in more affinity groups in the future. Bye, everyone.